Hello and welcome to Caregivers First, a show brought to you by SCAN. I'm your host, Lynette Whiteman, and I'm very happy today to bring you the latest information about aging and resources to make your life easier. SCAN is the Social Community Activities Network, and they are a nonprofit agency dedicated to helping active adults stay informed, empowered, and inspired. As a caregiver for my mother, I know firsthand that this role can sometimes feel like a lonely and difficult journey. Caregivers First was developed to give you knowledge to help you navigate this time in your life. Our expert guests will provide you with the latest information and tips to make your life easier. We hope to give you real-life tools and let you know that you are not alone. I'd like to welcome my guests today to the show, who are Derick and Kerri Buckley from the Buckley Insurance Group. So welcome, Derick and Kerri. Thank you so much for being here.
Thanks for having us.
So tell us about the Buckley Insurance Group, what you guys do, what you're all about.
Sure. The Buckley Insurance Group obviously is, we're a husband and wife team. We provide a free service for seniors. For people turning 65, we help them navigate through the plentiful information that they get with all the different Medicare plans. There are different types of plans with prescription plans, and we help them enroll. We do the education for them. And then for people who are already on Medicare, we help review their plans. We make sure they're not paying too much for their current plan, and we make sure they're on the correct prescription plan based on their medications.
Wonderful, wonderful. So let's go through the process, right? So you're turning 65. Do you get something in the mail that says, okay,
Sure.
Ding, 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 it's time to enroll in Medicare?
Well,
what's the process of that like?
I'm actually laughing because you get a million pieces of mail when you're turning 65, and I know anyone out there who has been through it knows you really get inundated with lots of confusing information from carriers, from other people trying to help you enroll. So it is very confusing.
You'll have telemarketers call you. We call it the Medicare maze. People get inundated, and you're on a list. It's public information. So prior to turning 65, all the vendors know it, all the carriers know it, and starting about 6 months prior, they're just going to bombard you. We take a different approach. We send out mailers. We don't call. We don't call anybody. We don't disturb their lives. And if they want our service, they call us through referrals or great things like this that get our names out there.
Okay. So in my world, I think of Medicare, you just enroll on Medicare, there's one Medicare, and then you get Medicare.
That'd be great.
I didn't know, I had no idea that there's options involved when you go on Medicare.
Sure, we call it the Medicare maze, the alphabet of Medicare. There's 4 basic parts: Medicare A, B, C, and D. And those are the basic parts. Medicare Part A is the free portion you get, covers hospitalization.
And everybody gets that across the board, you have no choice.
As long as you work 40 to 10 more years, 40 quarters, you get that.
Okay.
Or if your spouse did that and you were the stay-at-home mom or his husband, you're eligible for that. Medicare Part B is the one you must enroll in. That's the one that charges a premium. It's what Medicare B like in boy. If you're not collecting Social Security, you must enroll. You can do it via the Social Security website, by calling them, going online, or we can actually help them enroll if they're local. That is what they first need. So Medicare Part A and Part B. I'll take the rest.
Sure. Medicare Part C is kind of tricky because they're called Medicare Advantage plans. But really, when you have Parts A and B, you can go 2 ways. You can either go with a Part C plan, a Medicare Advantage plan, or you can go with a Medicare Supplement plan, which is also called a Medigap plan. And then there is the Part D, which is the prescription coverage.
Right. Okay, so my brain's exploding already, just thinking about this world and people not knowing this world and trying to navigate and pick what's right for them. So Medicare A, no choices. You get Medicare A as long as you've worked, and that pays for hospitalization.
Correct.
But that doesn't pay for if you go to the doctor just for a checkup. So Medicare B is for when you go to a doctor.
Correct.
Right? And there you have choices. There you could pick different Medicare B plans.
Okay, so Medicare Parts A and B together cover 80% of your medical expenses.
Okay.
Where you need to pick up the supplemental plans is for the extra 20% that Medicare does not cover.
Okay, and that's optional if people can
Yes.
afford that?
You can
or
just have Medicare Parts A and B and have
Okay.
80% of your medical expenses covered.
Okay,
And then you're self-insuring yourself for that 20%.
okay,
And then in all scenarios, you want to check your prescription plan as well.
right.
Now, the other wild card is some people are working. They may not need insurance. They can defer Medicare Part B.
Okay, so you get Medicare A, but you could wait to enroll
Correct.
on Medicare B.
Correct, and that's where it gets tricky as well. So if your spouse is still working and you're covered on the employer plan,
Right.
you may not need Medicare Part B. One big mistake we see all the time is people still join Medicare Part B, pay for that extra expense each month, even though they weren't required to do that.
Okay.
So if you're still working or plan on still working or your spouse is working, make sure you check with the HR department. Let them tell you what you need to do, whether join Medicare Part B or not. Chances are, in a bigger employer, 20 or more employees, you're not required to. If it's a smaller employer, you may be required to.
Okay. And do doctors, once you join on Medicare, they obviously accept Medicare, right? And is there some doctors that will only accept certain supplemental plans, or only can say no if you don't have like another supplemental, or doctors have to, if you're on Medicare, they have to? Because right now, if you have a certain insurance, they'll say, oh, I don't take that insurance.
Right.
Good question. I'll take the first part.
Okay.
So it's estimated about 95 or 96% of doctors in the country take Medicare.
Okay.
Some take Medicare assignment, which we'll cover later. Typically, Medicare stays your primary insurance, and you get a Medicare secondary insurance called the Medigap plan and Medicare supplement plan. When Medicare pays, the secondary insurance is required to pay as well. The federal laws, federal rules and regulations. So we've not come across a situation where the doctor will not take the Medicare supplement plan as well.
Okay.
It's called auto crossover. So the doctor will bill Medicare. Medicare will pay their 80%. They'll pass on the balance of the bill to the secondary insurance, and they'll pay it as well. Under a Medicare Advantage plan, that's a little bit different. That's the Part C that Kerri spoke about earlier.
Right, so with Medicare Advantage plans, the carrier becomes your primary insurer, not Medicare. So if you have a specific carrier and your physician does not accept that carrier's insurance, then yes, they would not take that Part C plan.
Okay.
It's very similar to when you're working. You have Cigna or AmeriHealth or Blue Cross Blue Shield as your primary insurance.
Right.
You must make sure your doctor takes that plan.
So what is the difference? You're mentioning supplemental and Medigap, or what is the difference between that?
So Medicare Supplement is also called Medigap.
Okay.
That is where Medicare stays your primary insurer, and you can use any provider that accepts Medicare anywhere in the United States. Okay. Medicare Advantage are the plans where the carrier becomes your primary, and they work like an HMO or a PPO network, depending on your plan, and you can only use the participating facilities in that plan.
Okay, so when you're working with people to pick out what's the best thing for them, what are the factors? Is it their health level, their income level? How do you decide which way to steer somebody?
Good question. Let me take a. So
Yeah.
the first thing we do on our website, we have what's called a Turning 65 checklist. And it'll kind of educate them step by step what they need to do to get enrolled, to get themselves educated, and then provide us or someone like us the information we need to help them make an informed decision.
Okay.
Health is a concern, income is a concern, prescriptions are a concern. It all factors in. Unlike when you're an employer plan, you have one choice or two choices, and you don't really do a whole lot of homework. When you're going to Medicare, you're kind of on your own.
Right.
You have to educate yourself, and we take all that into account. Doctors, hospitals, prescriptions, cost, monthly budget. We try to find the best plan based on their needs and their budget per month.
Okay. So this is such a totally new world for people that are entering this. And I imagine, so when you're getting those millions of letters in the mail and stuff, it's the plans pitching you, oh, come with our plan is the best, and then you get somebody else and you go, and then they say that their plan is the best.
That's a great point. So I would say 99% of the stuff in the mail is not educational.
Right.
Some carriers do have some educational guides. Those are very helpful. But the majority of the mail received is someone pitching their plan, someone like us trying to get their business. It's not really educational for the client in most cases.
Right.
So it's up to them to educate themselves, and there's ways to do that.
Right. Do you see people that eventually come to you that have made mistakes, like, what are you doing in this plan?
All the time.
You do?
Yes,
All the time.
all the time. Yeah.
All the time.
A lot of times people think the most expensive plan is the best plan.
Okay.
It's not necessarily that, especially in the case of prescription plans. Just because it's the most expensive plan doesn't mean it's the most cost effective or the best plan for them based on their situation. We countless number of times have saved people, up to $2,000 a year just by switching carriers and plans. So
The other misconception is when you're turning 65, you just go to the big names and assume that they're getting the best price and best rate and everything. Believe it or not, on a Medicare supplement plan, they're all federally regulated, so they're required to offer the same benefits, same services. It's like buying milk from ShopRite versus milk from Costco. But there could be a difference of 25% in that same exact plan or that same exact gallon of milk. And all the time we just see them, their neighbor says, I have this plan, go to this plan. There's no one size fits all. And for a Medicare supplement plan, you want to get the cheapest plan based on what you need.
Okay. And is there certain enrollment periods? I know for Part D, I live with my mom, so I enroll her in Part D. So you have a window of time that you could switch or sign up for that. Is that the same thing with the Medicare supplement sort of thing?
no. So how it works is there's actually an initial enrollment period for people who are turning 65, and that is 3 months before their 65th birthday, the month of their 65th birthday, and 3 months after their 65th birthday. If you go onto a Medicare supplement plan or a Medigap plan, you can change that at any time during the year.
Okay.
So the Medicare Advantage plans, the Part C plans, and the Part D prescription plans have the annual enrollment period every year from October 15th through December 7th. So that is the only time you can change those plans.
Okay. And how did you guys learn about this world? Like, what did you do to just being in it and working with it?
That's a great question. So I started my career in Wall Street. I worked for HSBC Bank. I was fortunate to live in London, New York, and Hong Kong. So somehow I become the go-to guy for insurance and financial questions of the family. And about 6, 7 years, actually 8 years ago, at least, Kerri's grandparents asked me to help them with Medicare. And it seemed easy enough, and I was shocked at the lack of knowledge out there, the lack of resources. I was confused myself, and I struggle with that. So that's how we kind of got started into this business. And the need that was there, I've always been an entrepreneur, and I got my insurance license just to try to help people, and it kind of grew into what we have today.
That's great.
But it all started with a simple question from my grandparents, and it's kind of blossomed from there.
I can imagine how it's just so overwhelming for people that you just pick one. Just so you pick one, so you don't have to worry about it anymore. So when we come back, we're going to take a short break now. But when we come back, we're going to talk about if you have a plan already that you've been using for 10 years and you're comfortable with it, or potentially your spouse dies and things change, what's the process and what's the best way to go around that? So hold on to that thought. So
Sounds great.
We're going to take a short break right now, and we're going to be right back with Derick and Kerri Buckley from the Buckley Insurance Group. So stay with us.
Thank you.
You probably already know that rehabilitation is a must for successful recovery from surgery, injury, or serious illness. What you may not know is that you're free to choose where you go for rehab. In Monmouth and Ocean County, the compelling choice is Care One. Where you choose to go for rehab matters, and with Care One, you have 4 convenient locations to choose from in Monmouth and Ocean counties. Care One at Jackson, Care One at Wall, Care One at Homedale, and Care One at King James in the Atlantic Highlands. At Care One, you'll work with a team of experts to develop a plan based on your needs and goals. You'll have the full support of caring, compassionate physicians, RNs, licensed therapists, and nutritionists dedicated to helping you recover successfully without setbacks at a pace that makes you comfortable and successful in meeting your rehabilitation goals. Once you take the first step with us, you'll never look back. Call 877-99-CARE-1 today and come for a tour.
Welcome back to SCAN and Caregivers First. I am your host, Lynette Whiteman, Executive Director of Caregiver Volunteers of Central Jersey, and I'm having a wonderful conversation today with Kerri and Derick Buckley from the Buckley Insurance Group. So, Kerri and Derick, before the break, we were talking about what people should do when they turn 65 and all the myriad things that come at them. So, for those people who are older, who have been on Medicare for a while, potentially have a supplemental plan, things seem to be going great, they're comfortable with it. Is there a reason why they should take a look at what they have? Or there's certain triggers that should make them say, hey, let me take a look at this, maybe I'm not in the best plan for me?
Sure. Any time really during the year they can call us and we can do a free review for them. A lot of times maybe on their birthday, when they get the notice from their carriers that their rate is going to increase, it's always a great time to reach out and see. The annual enrollment period, even though it is just for the Medicare supplements, you can change anytime during the year. It's still not a bad time. It rolls around the same time every year. It's October 15th through December 7th to reach out and reevaluate. You absolutely want to reevaluate your prescription plan every year because the carriers, they change their formularies, they re-tier drugs, they reformulate drugs. So prescription plans from year to year change. A drug that you're on in 2018 might not be covered in 2019. So you always want to make sure that you get that checked out. And you can do that through someone like us, or you can use Medicare.gov to run your prescriptions as well to check it on there.
Okay.
The other thing is, just like other industries, certain carriers change rates during the year. Some lower rates, some come in the new to market, just like any other market. Some companies have household discounts people are not aware of. Husband and wife get 7% discounts for certain carriers. They're not aware of that. That's where a lot of savings come in. So it just takes about 5 minutes to review it. They can go online themselves, or they can call someone like us.
Okay. So talk to me a little bit about the Buckley Insurance Group. So somebody goes on your website and they fill out that form with basic information, and then walk me through the process of how you work with people to pick the right plan for them.
The website's njmedicareplans.com with an S. And we're one of the few websites out there that will actually give them the chance to run their own quotes without talking to us. They can fill in their information, their zip code, their gender, their ages, and it'll give them a breakdown of the carriers for Medicare supplement plans as well as Medicare Advantage plan options. They'll tell you most time when you go online and you respond to something like that, they'll want your name, your phone number, your address, your email, and 7 or 8 people will call you. We don't do that. We let you, at your own leisure, print out what's good for you based on your age, and they can start the journey themselves. After that, they can then call someone like myself, my wife, and then you can walk them through the process.
Yeah, we do the whole education from top to bottom. We go through the different kinds of plans and the benefits and the costs, and really just, we have a kind of a motto now, and it's to educate, not to sell.
And then if somebody is not computer literate or has vision problems, or let's say it's a daughter caring for her mom who doesn't live close, do you help the people actually enroll in the plans? Do you go that next step?
Yep, and we'll actually go, excuse me, we'll actually go to the home as well if needed,
We cover the entire state. We have since 2009. About 70% of our stuff is done over the phone. But some people would rather have face-to-face. We have no problem with that. We understand people can't get to us all the time, but the majority of appointments are in our office or over the phone, and in case if they can't get to us, we'll get to them.
Okay. And then if let's say they enroll in a plan and it's not making sense to them, or they're getting these bills that they don't understand, or I just know for myself, calling the Medicare office, you just want to shoot yourself after a while. Do they contact you if there's an issue, or then
we encourage that. We just had a case where a gentleman is going through chemo, has a Medicare supplement plan, going through a very, very prominent hospital in New York. I won't mention the name. He's been getting chemo for the last year and a half. and he's been getting bills from the facility. He's paid almost $7,000 out of his pocket. By chance, we had a conversation, and he said, by the way, your plan's terrible. And I said, what do you mean? He said, your Medicare supplement plan, there should be no bills. He said, well, I paid $7,000. We did a 3-way phone call. We called the hospital. Within 10 minutes, they said, you're right, we made a mistake.
Wow.
They reimbursed him $7,000.
Wow.
People are scared. They don't want to jeopardize their care. Just make the one extra phone call to ourselves, to Medicare, or the carrier that you're dealing with. There's also, I don't want to call them scams, but there's actually people out there that will do what's called balance billing. And people get nervous. They see the bills. They confuse explanation of benefits with an actual bill, or they'll worry about their credit. Do not pay any bills until you speak to us or your insurance carrier.
Yeah. So they become part of your
They're part
client
of the family.
and then you advocate for them going on. Yeah.
So when I first started the business, I was by myself. I was taking all the phone calls, working out of our basement and our dining room until she kicked me out. So over the years, I've been fortunate to add staff. There was just not enough I could do to handle it.
Yeah.
And I brought my wife. My wife got licensed about 3 years ago, and it's been a godsend because she'll take care of all that stuff. She has a lot more patience than I do.
Yeah.
And she takes care of that stuff for us.
So totally off topic. I tried to work with my husband. It lasted 5 minutes, and we were going to kill each other.
Correct.
So how do you guys? How long have you been married?
We've been married for 23 years.
Wow. So how do you manage working together?
I say yes, dear, a lot.
Okay. See, maybe that was the problem with my husband. But
It was tough in the beginning.
Yeah.
It was a very tough adjustment. I think I quit like 3 times the first week.
Well, let me tell you why. My wife is very competitive.
okay.
And she likes to have total control of what she does.
As she should.
And she wanted to know as much as I did day one.
Okay.
So once we adjusted to that, and we have 2 separate offices,
Okay.
And 2 different work styles.
Absolutely.
Yes,
2
that was the
totally
problem.
different work
Absolutely.
styles.
Yeah,
So now we've gotten in our groove.
I think we're in our groove.
Yeah.
That's awesome.
Yeah.
That's
For
great.
today we are. And actually, I had to wear blue today, so I'm starting to follow her advice.
Okay, very good. Smart man. Very good. And so you're learning along the way, and things probably change all the time, right?
They do. It's very fluid.
Yeah, and which regular people wouldn't keep up with.
That's probably the hardest part of our job. We don't work for Medicare. We work with Medicare, and to protect the consumers and the seniors. There's compliance, regulations, certifications that we're required to take on a yearly basis. We have to stay up to date with tax, not so much tax laws, but things that are out there that are topics to people. We have to make sure we're certified, compliant, always have the interest of the senior at heart.
Okay.
And that takes a lot of time out of our day.
Right. And how do you guys get paid? Does the client pay you a certain fee, or how does that work?
No, as a rule of thumb, if you are working with an agent, never ever write a check out to the agency or the agent. Always goes out to the carrier.
Okay.
In the state of New Jersey, or actually most states, whether you call us, the carrier directly, or go online, it's the same premium. There's no discount, or we don't steer anybody in a certain direction, and we get compensated by the insurance carriers, just like your home or auto agent does. We're typically a broker,
Okay.
but we have no allegiance to any certain carrier.
Okay. And so you don't get paid more if you steer people to this plan or
No.
that plan. It's
No,
all the
that's
same.
actually-
So you don't have an incentive to.
No.
It's just looking out for their best interest.
I wouldn't call it legal, but I'd call it immoral to do that, and we just don't advocate that.
Okay. And do you provide any education to the community about this world?
question.
Is it through your website? Do you do seminars?
Yes, we actually just started doing seminars.
Okay.
We have 3 upcoming seminars, March 29th and April 23rd at the Clarion Hotel in Toms River on
Oh,
Route
nice.
37, and April 13th at the Hilton Garden Inn in Lakewood.
Okay.
We're running them all year long, but those are our 3 right now. And we just did our first one March 12th, and it was very successful. We had great turnout, and we got very positive feedback from it. Just people saying how informative it was. It was geared toward people turning 65.
Okay.
Just to touch on that, it was something I've been asked to do for years. I just never had time to do it. We blocked off an hour and a half. We were worried about filling the time. We couldn't get them out of there.
Is it the questions?
Just the questions,
Yeah.
the confusion. There's about 35 people there. We absolutely cannot and will not discuss pricing or plans or a particular carrier. Purely educational.
Strictly educational.
They sign in, they give us information they want, and they leave. And by law, we actually can't even try to enroll them or give them pricing at that point. It's purely educational.
And what other resources are out there for people new to this world? Should they go on websites, or should they go
Sure.
How can people educate themselves about this world?
3 ways. So the Medicare.gov is a great website. We reference it all the time.
We do, yeah.
And that's quite honestly how we run people's prescription plans. We use them as a great source. They're a tremendous website. There's times we look up there to verify things as well. You and I discussed SHIP.
Right.
They are a great program as well. They are educated counselors. They provide a free service like ourselves. They help educate. They have no bias towards anything, which is great for the consumer. Unlike us, they cannot enroll the certain client in the plan, whereas we kind of take them step by step through the plan. And of course, websites like ours. There's other carriers that do the things that we do. But just educate yourself.
Great. I think this is so helpful. Even just there's so many caregivers that don't live close to their parents, and then their parents are not on the internet, and they don't have this knowledge, or a parent dies and that other parent doesn't know what's going on. So I imagine you get calls from caregivers a lot, just saying, I'm trying to help my mother or father navigate through this world. Right.
It's the transition of wealth now, right? So the boomers are now taking care of the parents. Parents are living longer. Our grandparents never kind of faced this type of situation. So the children are taking care of them. They're educated, and I can't tell you, there's people that are in the workforce that have high-functioning jobs, make a lot of money. They call me up Medicare and say, I have no idea what I'm doing.
Exactly.
So I can't imagine a caregiver or someone like that trying to do the same thing. It's added stress. It's very, very hard.
I'm in this world. I know nothing about this.
It's humbling.
Yeah, it is. It is, and it's so confusing. It just seems like there's so many twists and turns, and this and that, and this and that, and yeah, it just seems like it would be a hard world. So your website is New Jersey
Medicare Plans with an S.com.
.com.
NJ Medicare Plans with an S.com.
Okay, so people could go and check that out.
Please.
And just in a few remaining moments, is there a person that stuck out for you, that came to you, that maybe they were paying so much more money and you helped navigate them to...
Yeah, I think I kind of referenced it before, but we have actually very close friends of ours who just said, just take a look at our stuff. You know, I'm sure it's fine. You know, we're on the best plan, and we wound up, they went through one carrier for everything, which was their prescription plan as well. And I mean, their prescription plans alone, they were paying $99 a month, and we're on generic drugs. I dropped them down to a plan that was like $19 a month. So in total, we saved them over $2,000 a year.
That's great.
And it's just, people just don't know. And it's
we have people
very gratifying.
People on a monthly basis will cry, say God bless you. And unfortunately, we deal with people with cancer, and they call us and they say, thank God we met you, because everything's being taken care of and you helped our lives.
Thank you. Well, thank you so much for being here today.
Thank you
for having us.
And Derick Buckley. And their website will be on the we'll have a link to their website. And what's your telephone number for people just to call if they want it?
It's 732-746-3320.
Wonderful. So thank you for joining me today at Caregivers First. I know I learned a lot, and I hope that you learned a lot as well. And we'll see you back here next time.
Thank you very much.
Thank you.
Thank you.